Welcome back to Morning Joe, 39 past the hour. Joining us now from Capitol Hill, Republican representative from Georgia and chairman of the Republican Policy Committee, Congressman Tom Price. And in Washington, MSNBC political analyst and Pulitzer Prize-winning writer for the Washington Post, Eugene Robinson, back on the show. Eugene, good to see you.
Hey, Congressman, we'll start with you. Thanks so much for being with us. So,
Thank you.
You heard what Chuck Schumer said. Others are talking about how Republicans trying to repeal the president's health care plan will cost hundreds of billions of dollars. What's your response to that?
Well, this comes from a group who believes that PAYGO actually was a responsible fiscal mechanism that left us with $1.4 trillion in debt each of the last 2 years. So what we believe is that you actually got to look at the numbers and work with real numbers. For example, the Obamacare repeal, the repeal of the health care bill that they say costs $143 billion added to the deficit. In fact, it would free up $700 billion if you really look and you quit using the gimmicks that they use to pass the bill. So it's garbage in, garbage out.
And Tom, you know, it just seems to me, just intuitive, that if you get rid of a huge entitlement program, you're going to save money.
Exactly.
And yet, if we're going to live by the CBO numbers that I quote religiously, don't we have to die by the CBO numbers if the CBO tells us that what we want will cost taxpayers more money in the long run?
Well, it's one of the things that actually we need to have a discussion about and come to an agreement about how you're going to score these things, how you're going to figure out how much they're going to cost. Because the CBO, they're good folks, but they only give you based upon the information that you give them. And so the whole system is gamed. That's why we've got to get a new system, a new way to be able to determine how much programs are actually going to cost so that you can actually compare real numbers, apples to apples. Right now it doesn't work, and so it's garbage in, garbage out.
So the debate that the CBO has spurred over whether or not health care repeal increases the deficit by a massive amount of money, that you'd look at those numbers, wouldn't you, as a Republican?
Well, absolutely. You look at them, but they're flawed. It doesn't include the $115 billion that it costs to run the program. But it doesn't account for the double counting of the Medicare, quote, savings that they have. It doesn't account for the $500 billion in taxes. It doesn't account for the money to reimburse physicians for the services that they provide. If you actually use all of those real numbers, then the bill itself, repealing it, will save $700 billion.
So we want to go to Gene for a second, but I just can't let this pass. Lawrence, obviously you know this better than anybody. You've worked finance. It seems counterintuitive to say if you get rid of this huge entitlement program, it's going to cost you more money. I got to be honest with you. I don't believe those numbers.
Okay, here's where the CBO...
I speak that in total ignorance.
No, you're right. No, because look, what the bill is, half of the bill is a giant expansion of Medicaid. Okay, so that is a new cost. There's a piece of the bill that is very important, which is a $500 billion cut in Medicare. There's a giant Medicare cut in this bill. That's where the savings are coming from. The savings are not coming from creating the new entitlement. The new entitlement costs you money. There's also revenue in this. There's 15 different taxes in it. The biggest tax in it is a tax that has never existed before, and I will safely predict to you absolutely has no chance of raising the amount of revenue that the CBO says it will raise. It's a tax that we've never tested. It won't work. But this is all academic because we're not going to repeal health care.
That's exactly the case. So Eugene Robinson chime in. I'm just wondering, though, if this is the top goal that should be on the top of the list for Republicans as they move forward.
Well, you know, good luck to them if they think this is really the best thing to do. I don't think this should be the top goal. It's not going to happen. The Healthcare Act is not going to be repealed. It'll get through the House. It's a symbolic vote. But and I'm sure some of the Republican base, especially the Tea Party supporters, who feel very strongly about this, will be cheered by that. But I really do wonder what independents are going to think and and others who are kind of watching this sort of no drama, the shadow play going on in Washington that everyone knows is not going to lead anywhere. It seems a bad way to start.
Tom, it may not lead anywhere, but how about defunding the program? That's easier. That's easier, isn't it?
Look, that's the next step. It's important to vote to repeal in the House for three specific reasons. One, it's what we said we were going to do, and Washington rarely does that. We made a promise to the American people, if given the privilege of leading once again, we would vote to repeal. Second, the National Federation of Independent Business and the CBO actually estimate that this will cost somewhere between 600,000 and 1.6 million jobs, so it's a job killer. We need to stop that craziness. And as a physician, I can tell you that the bill itself is destructive to not just quality of health care, but accessibility and affordability. So for those reasons, it's important to vote to repeal. Now, that being said, you're right, it's not going to become law because even if it got through the Senate, the president would veto it. So then you have to work on positive, patient-centered proposals and solutions to this system, which is where you defund portions of the Obamacare bill, and then you move forward with getting more people covered with insurance that they want. You solve the insurance challenges of portability and pre-existing, and you address the huge issue of lawsuit abuse, which wasn't addressed in the bill.
Let's go to Donnie Deutsch.
Eugene, I want to ask you, beyond the fact that there's no chance of repealing it, the Republicans are so tone deaf to not understand that they kind of have the mantle now to move forward. I don't want to say to be progressive because that's obviously the wrong word. The public just wants to move on at this point, and they want it just sets them back. It is so strategically wrong beyond the fact that it can't get done.
I would agree, Donnie. I mean, I thought one of the smart things, and I didn't not totally agree with it at the time, but I think one of the smart things President Obama did when he came into office was say, we're not going to look back at the Bush administration, what it did, in terms of the secret CIA prisons and Guantanamo, and a lot of issues I cared very passionately about. But he said no, he didn't want some sort of truth commission or anything like that. He wanted to move forward, and I think most people agreed with that. It's time to move forward. Certainly now, still in the economic crisis, people want to move forward, and I don't think they want to talk about health care.
Do you speak for, you don't speak for all the people. I mean, this is the defining issue. Barack Obama's numbers started collapsing in August of 2009. If I'm a Republican, I know that most of my independent votes came because of health care. I know most of my contributions came because of health care. Because if you tell a small business owner that this health care bill is not relevant to their life, they will laugh you out of their small business. Gene?
Exactly.
Well,
do you not believe we ought to do what we said we were going to do?
The health care bill cuts both ways. And, Joe, as you know, when you ask people about the health care bill, which has been painted as big government takeover, yada, 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 most people disagree, don't like it. When you ask people about specifics in it, most people like the specifics. So this is an issue that cuts both ways. But in any event, we've litigated it. It's done.
Congressman, congratulations. When are we going to get specific cuts moving forward to balance the budget? Is that coming in the next couple months?
It will indeed. The first issue is making certain that we pass this repeal of Obamacare, and then we move forward with specific spending decreases, as well as making certain that there are no tax increases on the American people or American business, so we can create jobs in this country.
All right.
Congressman, thank you. Eugene, thank you. Weekend Review is next.
Yes, I'm stuck in the